Quickly, I want to talk to you about Alison Morrow's video she just uploaded about the censorship of Brett Weinstein and Dr. Cory's video on ivermectin. So let's play that now, a little clip, and then I want to talk about that for just a minute.
The WHO is saying they just don't have the data. It's not that they're saying ivermectin doesn't work. They're just saying they don't have the data. Okay? And that's who YouTube says that, is the authority on the subject. And if you're in mainstream corporate news and you're not digging into this and all you see is just somebody's video is removed, or maybe you don't even see the video was removed at all. So all you know is nothing, basically. You just know the black hole void of the internet where all these ideas are being suppressed. And you're only hearing the mainstream corporate news talking points and the doctors that are allowed to talk there, which are basically also allowed by kind of the same class of thought and ideology.
Okay, so what she's saying there is important, and that there's censorship, but unfortunately the acupuncturists, chiropractors, and naturopaths have been dealing with this for years and years and years. So not only is our information suppressed, but in addition to that, we're having to deal with being ridiculed as quackery and snake oil. And so in that video of Dr. Cory's and Brett Weinstein, they also talk about the fact that information is not supposed to flow from the NIH and the CDC down. It's actually supposed to flow mainly from the frontline doctors up to the researchers, and then from the research to the CDC and NIH, and then back down to just inform us what has been found. And it starts from the frontline doctors. Unfortunately, as time goes on, it has been reversed, that the frontline doctors' hands are tied, and until the researchers research something and then the CDC and NIH tell the doctors, okay, we're now sanctioning it, they can't do anything. And the weird part with that is, well, who's telling the researchers what to research? Who makes that decision? Do they just sit in a lab somewhere, just kind of, twiddling their thumbs and imagining let's research this, it sounds good? No, somebody's telling them what to research. I don't know who that is, but it's supposed to come from the front lines. The doctors are supposed to see what's happening with patients. They're supposed to do initial stages of experimentation, like, this person's sick, I don't have time to wait 5 years for the NIH to tell me what to do. I need to experiment and try things, and maybe the patient dies, but then someone else comes in with the same condition and you try something different and that works. And so you try that on other patients. And if it doesn't work on other patients, well, then you drop it. But if it keeps working patient after patient, well, now you found something and you report it. And now the researchers can then go research it to find out, why does this work? Is it actually working? Is it not placebo? And all that kind of stuff. But it starts with the frontline doctors. So that's the number one problem, is that that has been reversed. It's turned on its head. But the chiropractors, naturopaths, and acupuncturists are frontline workers for a type of epidemic that nobody really talks about, and that is medical failure. There's thousands of patients out there that medicine has failed to help with their chronic condition, and they have nowhere to go. I get patients all the time who come in saying, I've been to 20 or 30 medical doctors, and they're either not able to help me or they've been making me worse. So I then the NIH can't tell me what to do for this person, or else clearly if they did, then the medical doctors would have figured it out. So now I have to think on my feet. I have to try to help this patient the best I can using common sense and all of my experience and knowledge from my studies in order to help them. And sometimes I can help them and sometimes I can't. But when I can help them, then I take a mental note of that. And the next time a patient comes in a similar condition, I'll try that treatment first that worked on the last person. It doesn't always work, but when it does, then I start to find patterns. And then if I find a big enough pattern, then I will tell my colleagues, and my colleagues then will start using that as well. And they'll give me feedback like, yeah, that really does work. Thanks for the advice. Or no, I'm not finding that works. So in alternative medicine, we're the front line in that way. Unfortunately, there's no way, because it's inverted, the pyramid's inverted, the scientists aren't going to be researching any of the alternatives to actually find out, to help us out with what works and what's placebo and so forth. The other issue is not just the medical failures, but the medical injuries. So I get a large number of patients that have surgeries that didn't work or that made them worse. And now I've got to figure out how to help these people too. And I can't always help them, but sometimes I can. And nobody talks about this, but it is published in journals that medicine is the number 3 cause of death every year. It's not listed usually because they have to tease out all of the information from all of the reportings and the different studies. But this has been published at least twice that I can think of, that when you actually look at the data correctly, the practice of medicine is the third leading cause of death, which is a lot of people, but it doesn't even touch on the even bigger number of people, like probably 10 times as many people that are actually dying because of medicine, are getting injured because of medicine, or at least are not being helped by medicine, and they have chronic conditions. And so that's what the chiropractors, acupuncturists, and naturopaths, at least the good ones, are trying to help with this huge epidemic of people. And you never hear about it because, one, it's suppressed, but also, even if you heard a chiropractor talking about it, you would dismiss it because there's so many videos out there talking about how we're quacks or that we're selling snake oil. And as far as I can tell, the main reasoning behind it is that there aren't any studies. So it's the same issue. The fact that there aren't big enough, expensive enough studies on ivermectin, well, that's why ivermectin doesn't work, and it's not safe, because there's no big studies. Well, that's the same reasoning that they give for why what I'm doing is snake oil, or what I'm doing is quackery, is because there's no big studies. And it's obviously a logical fallacy that just because there's no big study doesn't mean that it's unsafe or ineffective. It just means that you don't know for sure. It could go either way. So yes, that's all we want for ivermectin, and all we want for alternatives is to just say, yeah, it might work, but we don't know for sure. And then what they're talking about in Brett's second video is that, I forget what they call it, but do no harm. And so you look at the pros and cons of, well, this medication might help, we're not sure, but we know for sure that it has a very low risk of causing harm. So if you know it's not going to hurt anyone and it has a possibility of helping, why not try it, especially if it's really inexpensive? And that's what we're looking at with alternatives, is relatively speaking, they're inexpensive. And why not try them out when there's all these people out there that have been failed by medicine? Let's try out the alternatives, chiropractic, acupuncture, and naturopath. We don't know for sure that they're going to work, but we know that they're very, very safe. And for the most part, they're not going to hurt people. Yes, if you go to the alternative practitioner first before seeing the medical doctor, it could be unsafe if you have an emergency, like you're having a heart attack and you don't go to the emergency room, but instead you see your chiropractor. Well, sure, that can cause harm, but that goes with anything. If you go to the medical doctor and you're having a heart attack, and they could miss it too. They could say, oh, you just need to take up the dose of your Prozac or whatever it is. If they don't catch the fact that you're having a heart attack, then the Prozac is harmful because it was the wrong treatment. So that goes for anything. All right, that's all I wanted to say. Talk to you later.